energy, passion, compassion, and an innovative leader in her field. As a physician, expert, and teacher, her work has significantly changed the way the healthcare system responds to crises in communities where we live and those around the world. It is a true honor to congratulate Dr. Marina Salvadori, the 2017 recipient of the Health, Science, and Technology Women of Excellence Award. Her guidance and leadership during the Walkerton disaster, as well as her work on SARS, Ebola, and the Zika virus, have helped change public policy in Ontario, Canada, and the world. As an expert in immunization and immunization policy, Dr. Salvadori is a true leader, advocating for health and well-being of people and communities. All this while genuinely touching the lives of everyone she encounters along the journey. Congratulations, Dr. Salvadori, from all of us at 3M Canada.
When I think of what sets Marina apart in her field in terms of what she's done, her accomplishments, her attributes, I think there's a lot of them. When the Walkerton crisis occurred, Dr. Salvadori was there, Marina was there, at the scene, helping with the medical care, looking at the long-term interests in a way that was really, really remarkable. That was the start of a very promising academic career. It's really been very fruitful. When we think about her passion, Dr. Salvadori has been around the world speaking on vaccination, giving expert consultation to governments in South America, in the UK, and the US. As a Canadian academic from mid-sized centre, I think Marina is punching well above her weight, well above our weight, by influencing vaccine policy, not only for Canada, but for the world, and that's a big achievement.
I'm inspired by vaccines and by immunizations. When you think about vaccines on a global scale, before we had internet, before we had mass communication, before even everyone in the world had access to telephones, we got together as a global community and we eradicated smallpox, the worst disease that afflicted people. Every single one of us got it, and 1/3 of us died from it. And it was a giant venture of people getting together in the global community, World Health Organization, governments, and all people getting together to make it a better world for all of us. Now we're on the cusp of eradicating polio, a disease that everybody got, and last year there were 38 cases globally. So far this year we've only had 5 or 6. It's amazing what we can do together. And I'm inspired to be part of the global community that makes the best vaccine policy and helps control infectious diseases for all children.
Marina is an infectious disease specialist. She's a specialist in infectious diseases, often rare ones that occur in children. And there have been more than one child here, a number of children who have presented with very odd presentations, strange diseases, who have had various rare problems with their immune system, rare infections that Marina has taken the lead in trying out, find out what's going on, championing them, not giving up, fighting the good fight, making the calls as far away as Los Angeles to Atlanta, Georgia, Toronto, Vancouver, wherever she has to call to get the right answers, making sure those children see the right experts, those families get the right care. And I'm thrilled as her department chair to say that some of those children have actually done, most of those children have done exceptionally well. And it's not, it's not because of anything except really the tireless efforts of a dedicated clinician who wants to make sure that children under her care get the best care possible. And I think for a pediatrician, I think that's probably the biggest accolade anyone can have.
As a pediatrician, I recognize more and more that where children get and when they fulfill their potential, it actually entirely depends on where you started from. And that's why I really respect organizations like the YMCA and the Canadian Paediatric Society, who put a lot of effort and time into advocacy and policy to help children start at a better place. Being a woman in medicine, I really feel that there were no barriers to my getting into medical school, doing my residency, and working. I really felt I could do whatever I wanted to. And the more I've grown and the more I've walked along the path in medicine, I realize that on this path, there's a large number of women ahead of me. Some I don't even know, some were my fantastic mentors, and they moved the obstacles and barriers for me and opened doors so that I could walk through them. Doors that I didn't even know existed. And I think part of my responsibility as a woman in medicine is to look behind me and remove obstacles and barriers for other people. And they don't even know those barriers are there right now. But I think it's really important that we all work together to make anyone able to follow their dream or their passion.